The following program is sponsored by Reed Migraine Centers and features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.
Hello and welcome to Ask the Doctor. I'm your host, Mike Berger. Joining us today is Dr. Kenneth Reed from Reed Migraine Centers to discuss a revolutionary procedure used to alleviate migraines. Dr. Reed is the founder of the revolutionary Reed procedure, used specifically for treatment of chronic severe headaches. They will also be taking your calls and email questions. The number is 1-855-5-MIGRAINE, or log on to the website at www.reedmigraine.com. Dr. Reed, thanks for being here. Tell us a little bit about the neurostimulation and the Reed migraine. This is really fascinating. I know people that have had migraines. Most of our viewers know those people, and this sounds pretty impressive.
Well, I think it is. For patients that respond to this, it can be dramatic. It can change their life. Neurostimulation has actually been used for quite a while for pain in the neck and back, called a spinal cord stimulator. These have been implanted around the world. Numerous specialists in the DFW area have been doing it since the 1960s. Hundreds of thousands of patients for chronic neck and back pain. What we did is use the same technology but applied it for headaches. Initially in the back of the head in 1990s, where we had a series of patients, we reported in the medical literature excellent results. It's called Occipital Neurostimulation. That procedure is actually done around the world now for pain in the back of the head. Well, we found it didn't work as well for migraine headaches, more commonly pain in the front and side of the head. So about 6 years ago, we extended this technique, added in a frontal component, and now have seen an excellent response rate with, indeed, dramatic responses with most of our patients for this.
That sounds fabulous. Can you tell us a little bit about the microstimulator and actually how it works? Is that like a little battery somewhere that...
Well, exactly so. I think we have a graphic, if we can put it up. A neurostimulator, the device, and it's made by 3 large companies in the United States, all excellent equipment. It consists of a small battery. It's very similar to a pacemaker battery. In fact, the companies make these, and 3 long wires, plastic-covered wires. The battery is actually typically implanted in the upper outer hip, and there's reasons for that. Then it's very simple to pass these little wires up under the skin. 2 of them end up in the back of the head, right under the skin, over what we call the occipital nerves, and 2 pass over to the front, just right in the eyebrows. You cannot see it. There's no scars. You can't even tell it's there. It's actually a very safe procedure. When it's turned on, the patient will feel just a mild tingling sensation. It tends to feel very good, and by certain mechanisms, that will often dramatically ease the patient's pain.
I have to ask you, and I'm thinking about football players, anybody that plays sports, any chance that these wires would break or?
Well, another good question. We implant these in a lot of athletes. We have 30 teenagers so far, cheerleaders, gymnasts, water skiers, snow skiers, baseball player. Haven't had a football player yet, but we can absolutely put them in football players. There's no restrictions. It's very safe. Now, it is medical equipment. It could move or something,
sure,
but even then it's very safe, and we could replace it back there. But it's been very successful in our very active young patients.
How many types of neurostimulators are being used?
If you look on the internet, there's actually a lot of types and can be easily confused. For our purposes, we describe 4 different main types of neurostimulators. The most common one is what I mentioned earlier. It's been used around the world for neck and back pain, and that's called a spinal cord stimulator. By the way, the equipment is the same for them all. A little battery and these wires. The battery in the hip. For spinal cord stimulation, it passes the neck and back. Tingles will ease neck and back pain.
So it sounds to me like what you're saying is we're actually stimulating nerves.
That's exactly what we're stimulating. Under the skin, from the front of the head, it's called the supraorbital stimulator, the back occipital. That's what we term a Reed procedure. What it's doing is stimulating these very superficial nerves, not the brain, just right under the skin, the nerves. The patient feels a very mild tingling sensation. But by certain mechanisms, it looks like it's actually not covering up the pain, but actually working deep in the brain to actually stop the headaches from occurring in the first place.
And of course, once these are implanted, You can't see them. No one else can see them.
It's very interesting. It's completely under the skin. There's no scars visible. There's no lumps. Patients go out in swimsuits. Nobody can tell that they have them in. There's no restrictions. The patient can't feel it. Patients tend to get along with these quite well.
Now, you mentioned the Reed procedure, and you actually started doing this with migraine headaches some time ago. But the Reed procedure is a little addition to what a lot of people were doing.
Exactly so. It's what we term, the technical name for it is combined occipital nerve, supraorbital nerve stimulator. We were the first to apply them in the back of the head, occipital nerve stimulator in the 1990s. That's used around the world now. But about 6 years ago, we added in the two leads in the front. That combined system we call the Reed procedure for migraine headaches, and that's the one we're using in most cases now. All
right, the phone lines are open, and we want to get started, so let's go right to Robin from Addison. Robin, what's your question?
The neurostimulator, it sounds so like futuristic, Star Trek kind of, you know. Will there be a time when migraines will just be like history?
Well, you know, it's a great question. I think the way to look at this is this tends to be an extremely good, often dramatic, life-changing treatment for patients that respond. But I'd emphasize, it's not a cure. The headaches are not gone. They're there. This is stopping them. I think it's, you know, probably the next best thing. So like a lot of things in medicine, we can treat it, in this case, I think, very effectively, but like high blood pressure, heart disease, it's not a cure. It's an excellent treatment for it.
We really don't know what causes migraines, do we?
We don't know the full mechanisms. As in a lot of things, there's a lot of excellent research being done. International research, there's several medical journals that this is published in several times a year. Our research has been published in those. By the way, it's easily accessible on the internet. The research is down to fine neurochemical mechanisms, neurophysiology of the brain. We have excellent imaging studies, so we have a lot of information on how migraines work and what start, but still not the final answer.
Yeah, so one of these days, we might come up with that answer.
Absolutely. That's the goal. That's the Holy Grail.
We're going to take a short break. We'll be right back. This is an interesting show. Stay with us. And welcome back to Ask the Doctor. I'm your host, Mike Berger. Here to talk about a new procedure to alleviate migraines is Dr. Kenneth Reed from Reed Migraine Centers. Remember, we're also taking your calls and email questions. The number is 1-855-5-MIGRAINE. Or you can log on to our website at www.reedmigraine.com. Dr. Reed, who would qualify for this type of neurostimulation procedure? Everyone that has a migraine, or
Yeah,
not?
no, absolutely not. Who's a candidate for this procedure is probably the first question that people ask. Am I a candidate? And it's actually pretty straightforward. This tends to work on most types of severe headaches, migraine tension headaches. It is not for everybody. The candidate for this patient is somebody who has frequent severe headaches, maybe 2 or more times a week, and the key is they've tried more conservative treatment. This is not a first step in treatment. It's a surgical procedure. It tends to be towards the end. So people with headaches or a candidate, if they've gone to a headache specialist, a neurologist, been working with it, maybe several neurologists, medications, there's adjunctive treatments such as Botox. Very often those will work, and if they're working, you certainly don't need this. But oftentimes they don't work, or if they don't work and there's really nothing left to do, that patient becomes a candidate. So frequent severe headaches that have tried more conservative treatment and they're still having them, they're a candidate.
Are there different types of migraine headaches?
Well, there's a lot of different types of migraine headaches. Migraine headaches, some people just classify as a severe headache, but neurologically, they're very specific diagnoses. Patients that have them tend to know. They're going to neurologists, they can tell us the type. This treatment has been studied in several different types: classic migraines, common migraines, tension headaches, chronic daily headaches, cluster headaches, and in all of the studies it shows it to be very and similarly effective.
So how effective would you say the Reed procedure is?
How effective is it? First of all, again, it does not everybody responds, but if they respond, it tends to be dramatically effective. People describe it as getting their life back. I have my wife back. The children can function again. They're going back to school. They're enjoying life. At percentage, they'll describe over 80 to 90% improvement in the headaches. Sometimes nearly complete resolution of the headache.
Okay, I just want to quickly mention, I went to YouTube and I saw the video of the young lady, I think she's a sophomore in college now, had a migraine for 9 months, and this procedure literally gave her life back.
Exactly so. Kim, who couldn't function, she had to withdraw from college. She was living with her parents here in Dallas. Her dad's a well-known orthopedic surgeon. She could literally not leave the house. Just over 4 years ago, they contacted us. We did the first step, which is a test procedure to confirm that it works, and then we implanted the full system. This is 4 years later. She is virtually headache-free. She takes no medications, lives a full, active lifestyle, and is doing
and
just
she
great.
likes you a lot.
Well, it's been very gratifying. Most of the patients are very, very pleased. Sure.
Well, we've got to take a short break, and then we're going to come back with some more calls and some email questions. Stay right here with us. So you've suffered this.
Oh, yeah. Oh, yeah.
And welcome back to Ask the Doctor. I'm your host, Mike Berger. We've been talking about the Reed procedure for treating the worst migraines. And remember, we're also taking your calls and email questions. The number is 1-855-5-MIGRAINE. Or you can log on to www.reedmigraine.com. Joining us now is Kay Shirtliff, who has been suffering from headaches since she was 15 years old. Kay, how often were you having migraines?
Well, when I was young, I had them once a week, twice a week, something like that. And then as I got older, different things happened, and it gradually got to the point where I was having them 24/7 for the last 6 years.
24/7 for 6 years?
Yeah.
What in the, how did you do that?
Well, you would do the same thing. I mean, you have to make the decision, either I'm just going to hide from the world, or I'm just going to put one foot in front of the other.
Well, what type of procedures did you go through? Because obviously with pain like that, you're looking for some help.
You are. I saw several neurologists. I have a wonderful neurologist, and we did 67, something like that, different drug protocols.
67? Mm-hmm. Wow.
And then we tried lots of other things: trigger point injections here and here, surgical nerve block, acupuncture, chiropractic, massage therapy.
And you just have to feel kind of let down, because you go home and you and your husband, your husband says, well, how did it work? And he says, not so well, nothing happened.
Yeah, you do get to the point where you just think, nothing, this is just it, nothing's going to work.
Well, how did you hear about Dr. Reed's procedure?
The neurologist that I see, we talked about different options, and his nurse practitioner actually mentioned, this is something that's out there on the horizon. And then I decided to get another opinion from yet another neurologist. So I saw her, and she looked at all my records, and she said, well, I can try to treat you, but my first suggestion would be that you would go to Reed Migraine Center.
So now, earlier, Dr. Reed told us that when the patients come in, they actually do a test procedure. How did that work for you, and were you a little nervous about that?
Not really nervous because it's it's a win-win kind of a thing. Nervous a little bit that it wasn't going to work and it was just going to be one more thing that we tried.
Oh, okay.
But the procedure itself wasn't any big deal at all. In fact, I went to work the next day with it.
So with that procedure, with the test procedure, did that indeed help your migraines?
It did. At 4 o'clock in the morning, I woke up the day after the procedure. Well, I'd had the procedure the day before, and at 4 o'clock in the morning, I woke up because I felt like something's wrong and realized it's because I didn't have a headache. So I woke up my husband and said, "You got to know this. My head doesn't hurt anymore. Wake up."
That's got to be just an incredible feeling that for once in 6 years.
Yeah. Yeah. I went from just saying every day to my husband, if I could have 5 minutes without a headache, I could do all my thinking then, and then I could just function.
Yeah. So now you're ready for the procedure. We've tested it, seems to be working. Go see Dr. Reed and get it done. How did that work out?
It was wonderful. I mean, we had a little party in the hospital room that night. It's been, 13 weeks and 3 days, and we celebrated every day.
So you've had it just, about 3 months ago?
Mm-hmm.
Is that it? And every day now, migraine-free.
Every single minute of my life is different.
That's incredible. What's it like living with that neurostimulator? Because I know you have a little battery implanted in your hip.
It's really not a big deal. You don't feel it. You don't really think about it unless you feel a headache coming on, or you can sort of do a preemptive strike and change the setting if you think you're going to be in a situation that's going to cause a headache. But other than that, it doesn't really affect your everyday life.
So how do you change that stimulation?
You have a little remote.
Oh, you do? So it's remote controlled.
And there are a bunch of different settings, and you can change it if you want to feel it more intensely here and less here, then you can regulate that.
Well, I would ask the question, how do you feel now that you've had the procedure? But I would say you're probably the happiest woman in the world.
I sure am. And it's the difference between saying, I wish I could have 5 minutes to have a clear thought, and saying, oh, let's go walk the dogs, let's go to a movie, let's plan a trip to Ireland. So all of those things are things we couldn't do before. Now,
I know since you lived with something that long, it's real easy to wake up one day and you don't have a headache, but you're saying, I wonder if this is coming back. I wonder, is it still just too good to believe, but it really works?
It is kind of surreal still at this point, but it's never, I've had one day that I've had kind of a headache that I couldn't quite get under control. My worst days now are so much better than my best days were then.
That's an incredible story. I am so happy for you, and I'm sure everyone is. It's something to look into if you suffer from migraine. Thank you so much again, Kim, and we are going to return and we'll look at the process to see if you're a candidate when we come back with more Ask the Doctor. Stay with us. And welcome back to Ask the Doctor. I'm your host, Mike Berger. We're talking about neurostimulation with Dr. Kenneth Reed of the Reed Migraine Centers. Dr. Reed, walk with us through the process of determining who may or may not be a candidate for this procedure.
Well, the first step is once the patient becomes interested in this procedure would be, we'd like them to come to an information seminar. We actually give these around the United States in major metropolitan areas, but here in Dallas, typically every other week, every other Thursday night at one of our hospitals, we'll do a full information seminar. Like the patient to come in, we spend a lot of time going over this in detail, the pros and cons. We generally will have a patient there, like Kay is here today, that they can talk to the patient about it. And it's to help the patient determine for themselves whether or not this is something they're interested in. If they are, then the next step is a visit to the doctor's office, one of my colleagues for a new patient visit, go over their case in detail, determine whether they're a candidate for the trial procedures. 2 steps. The first step, the test. 2 weeks or so after that, they'll do the test stimulator, just as Kay described a bit ago. And if it's successful, meaning they get a very good response, they really like it like Kay did, then about 2 weeks after that, we have them come in for the full implant. Okay. The battery lasts a good long time, and they tend to be very happy.
Good. Here's an email question, and we want to get to some questions. Carrie in Dallas writes, what kind of follow-up care would I need with this neurostimulator?
Well, it's an excellent question. I really appreciate it. At first, first 6 weeks, there's a few visits to our office, mainly for us to check the system, that it's functioning correctly, to fine-tune it, if you will, with programming. But once it heals up after about 6 weeks, we have the patient return as needed. We'll have some patients that'll go for years without having to come back in. So in other words, there's not a lot of problems with this, not a lot of fuss or muss. It tends to be very easy.
Very good. And we talked about the seminars, where they are. They're at different hospitals. So if someone wants to get information on that, they can either call your office or they can go to the email and ask you.
Exactly right. I think the numbers are up here on how to call, or I'd probably recommend visiting our website, reedmigraine.com. We have the seminars listed. We have a lot of patient information, testimonials, and then I have some videos of frequently asked questions. They can get a lot of information from the website.
Now, you mentioned the battery lasts a long time. Can you be a little more specific about that? And when the battery eventually dies, which they all do you just go back in and re-implant a new one and away you go?
That's exactly what we do. I can be very specific. The battery lasts upwards of 10 years. It's a very reliable time. For the 10 years, it's going great. When it does run out of energy, and we know that when it's coming up, if the patient needs it beyond then, it's a very simple 15-minute outpatient procedure just to switch the battery out, and they're good for another 10 years.
How safe is the procedure, and are there any risks?
Well, of course there are. This is a medical procedure. It's a surgical procedure, and as with any surgical procedure, there's risk. But given that, we feel it's actually a very, very safe procedure. The things people are concerned about, such as problems with the brain or spine or nerves, it's extremely safe for that. There's never been an instance of nerve damage or anything like that at all. The one risk of the procedure, the most common one, would be a very small risk of infection. Any surgical procedure, sure, anything implanted could have a slight risk of infection, which is absolutely treatable. But that's really about it. People tend to do very well with this. Problems are very, very rare.
Very quickly, Dr. Reed, I know the people out there have about as many questions as I do, and we could stay here all day. What's the best way to get some information again?
I really think the best way, the first step would be the website. Tremendous amount of information there. But for somebody that's really interested, no question, the best way is to come to an information seminar. There's no pressure. It's purely us providing the information, a lot of times for questions and answers.
Very good. And once again, I'll remind you that that email's website is www.reedmigraine.com. Or you can call their phone number, 1-855-5-MIGRAINE. So either way, if you would like more information about Dr. Reed's procedure, by all means get in touch with him or one of his associates at the Reed Migraine Centers as soon as possible. Thank you so much for joining us. Have a great day.
This program is sponsored by Reed Migraine Centers and features medical questions from viewers. Nothing within the program establishes doctor-patient confidentiality.